Magandang umaga po sa lahat ng Juan at Juanang nanonood sa ating DOH platforms, sa lahat po ng ating media partners, at sa lahat po ng experts na kasama natin sa umagang ito. Welcome po to our Kapihan session on addressing social determinants of health to eradicate water and foodborne illnesses and other notifiable diseases. I am Dr. Laura Del Calio Renegado from the Department of Health, your facilitator for today. Today, we have with us the OIC Undersecretary of the Public Health Services team, Undersecretary Beverly Lorraine Ho, to discuss social determinants of health, sectoral interventions and reforms, and Dr. Alethea de Guzman, Director 4 of the Epidemiology Bureau, to give us status updates on the notifiable diseases. Before we start our discussion, here are some house rules to ensure smooth flow of the session. To ensure the smooth flow of this session, everyone is encouraged to use the naming convention below for Zoom usernames to ensure proper acknowledgement. Pay attention to the discussion of our health experts and resource persons. Keep microphones muted while speakers are discussing and presenting. And should you have any queries, participants shall signify and send questions in the Zoom's chat box and wait for the host to acknowledge them. There shall be an open forum after the discussion. Submitted questions will be addressed first by our experts, followed by Zoom chat box questions. Every participant is advised to reserve questions. Now, only questions related to the topic discussed will be entertained. Now, to start our discussion, please welcome Dr. Alethea de Guzman. Dr. Good morning po.
Thank you, Dr. Laura, and good morning to our NewsSec and of course to our media partners. So ngayong umagang to, nais po namin magbigay ng update sa ilang notifiable diseases na binabantayan ng Department of Health. At ito ay ang mga diarrheal diseases natin, specifically cholera, ang dengue, ang measles, rubella, at ang rabies. Panimulan ko sa pagbibigay ng information na we actually have two main systems we're using to detect select diseases and other acute public health events under the Philippine Integrated Disease Surveillance and Response System being managed by the Epidemiology Bureau. First is our case-based surveillance, which collects line lists through our information system. And the second is our event-based surveillance, which collects reports of clustering, outbreaks, and other unusual health events. The systems are consolidated so that we can provide a more comprehensive disease situationer. So unahin natin yung mga tinatawag natin mga endemic diseases. Tumungo tayo doon sa mga food and waterborne diseases which usually present as acute gastroenteritis na pwedeng maging magmukha or magpresent as diarrhea, pagsusuka o di kaya pagsakit ng tiyan. Nationally, meron tayong 300 food and waterborne health events na nakuha mula January until September 2022 through our event-based surveillance. Ang dami ng health events ito ay 205% higher compared doon sa 74 na nakolekta natin noong 2021 during that same mga ganitong health ay naitala mula kadalasan dumadami ang mga food and waterborne health events kapag nagsimula na ang panahon ng tag-ulan. Nais din nating i-note na while mas marami ang health events itong 22 verse 2021, nitong nakaraang 5 taon, nung 2017 tayo nakapagtala na may pinakamaraming food and waterborne events at 375. Base din sa event-based surveillance reports natin, itong nakaraang 3 buwan from July 3 until October 8, meron tayong 110, no? Or it's 45% of the total health events which are reported to be food and waterborne diseases. Sa Region 8, 12 at 6 tayo nakapagtala ng pinakamaraming na report na food and waterborne disease health events. Pinapakita din dun sa table sa baba kung saan tayo nakapagtala ng mga clustering either ng diarrhea, cholera, or acute gastroenteritis mula usually sa, nakita natin to mula sa Region A, 4A at 6 at 11. Subalit, sa mga clustering mula sa 4A at 6 tayo, naka-record no, ng mga kaso na nagpositibo sa cholera. Tumungo naman tayo sa cholera situationer kung saan makikita no, ang cholera cases natin represented nitong 2022 by these yellow lines are actually higher than what we reported even during the pre-pandemic years. No? Ang epidemic threshold represented by this red line has actually been breached nitong July. No? At ito din yung panahon kung saan tayo nakapagtala ng pinakamataas sa mga kaso ay tinatawag nating peak ng cases natin. Pero makikita din natin dito sa yellow bars na to na makaraan nga ng peak ng July ay bumaba na no, ang mga kaso ng cholera at mukhang nagpa-plateau na over the last month. Kung titingnan naman natin itong nakaraang buwan nationally, meron tayong 253 cases na na-report 3 to 4 weeks ago at ito ay mas mababa na no, by 3% compared doon sa naitala natin 5 to 6 weeks ago o yung dulo ng Agosto hanggang unang linggo ng Setyembre. Ang pagbaba na to nationally ay nakita natin sa halos lahat ng rehiyon, liban sa Calabarzon, Mimaropa, Region 5 at 6 na makikita dito ay may pagtaas pa no, by 50 to 111% ng 3 to 4 weeks ago in comparison to 5 to 6 weeks ago. To summarize, ito yung mga lugar na gusto nating i-flag. Una, ang regions 3, 7 at 8 ay nag-exceed ng epidemic threshold nitong nakaraang 4 na buwan, subalit wala tayong specific na province, highly urbanized city or independent component city na nag-breach ng epidemic threshold. Meron tayo, however, 7 provinces, HUCs, and ICCs na merong positive growth ng cases. Ibig sabihin, dumami ang kaso nitong 3 to 4 weeks ago kumpara 5 to 6 weeks ago. At ito yung Olongapo City sa Region 3, Camarines Sur sa Region 5, Catanduanes at Masbate sa Region 6, at Eastern Samar, Leyte at Ormoc sa Region 8. Doon naman tayo sa dengue, no, as our second endemic disease for presentation today. We observe na merong tuloy-tuloy na pagtaas nung nagsimula ang morbidity week 12 or yung 3rd week ng Marso, na peak tayo no, noong ikalawang linggo ng Hulyo at ngayon makikita natin dito sa epidemic curve na to na tuloy-tuloy na yung pagbaba ng kaso ng dengue. Tayo din ay lumagpas no, sa ating epidemic threshold. Pero simula nga po ng Agosto, nandun na tayo sa ilalim both ng epidemic, which is this red line, at nung alert threshold natin. So ito'y magandang senyales na yung ating mga naging intervention for dengue ay epektibo at nakakakita na tayo no, ng tuloy-tuloy na reduction ng ating mga kaso. Though lower na nga ang mga cases nitong mga nakaraang linggo, posibleng itong mababang numero na nakikita nyo sa last 2 bars ay pwede pang tumaas sa mga susunod na linggo because there may be late consultations or late reports. Makikita rin natin, no, nationally, meron tayong nakitang 11,939 cases 3 to 4 weeks ago, which is already 13% lower than what we reported 5 to 6 weeks ago. This decline nationally was also reported across all regions except for regions 10, 11, BARM, and NCR na may bahagyang pagtaas pa, no? May 7 to 14% increase with the exception ni Region 10, no, na may 80% increase pa nitong 3 to 4 weeks ago. So gusto pa rin natin ituloy ang ating monitoring sa pagpa-flag na meron pa tayong mga rehiyon na lumalagpas sa epidemic thresholds at these are regions 3, BARM, and CAR. Ang regions 2, 11 at NCR din ay above alert threshold pa. Sabihin, hindi pa tayo abot sa epidemic pero lumalagpas at malapit na tayo. Malapit pa tayo doon sa tinatawag na epidemic threshold. Meron din tayong 52 areas or provinces, HUCs, and ICCs na nilista dito dahil sila ay may positive growth in cases in the last 3 to 4 weeks. I-note din natin na itong mga nakamarka in red, no, had actually exceeded their epidemic threshold at least once in the recent 4 months. So yung 52 ay binabantayan natin and more closely the ones colored in red. Gusto rin natin magbigay ng updates doon sa mga lugar kung saan nagkaroon ng mga deklarasyon ng outbreak at ito ay nag-deploy tayo ng mga Field Epidemiology Training Program Fellows upang mag-imbestiga. At makikita natin na pagkatapos nga ng ating investigasyon at ang ating mga response activities, tuluyan ng bumaba ang mga kaso at karamihan sa kanila ay mas mababa na, no, both sa alert at epidemic thresholds represented by the blue and red line with the exception of Southern Leyte, no, na though bumaba na ang mga kaso ay nasa mas mataas pa ng kaunti, no, doon sa ating epidemic threshold. Okay, now let's go to some diseases for elimination. Una ay ang measles. Ang measles ay kasama sa listahan ng gusto nating i-eliminate na sakit. Subalit dahil nagkaroon tayo ng mga malalaking outbreaks, nandun tayo sa tinatawag natin na phase of disease control at hindi tayo nandun pa sa phase of elimination. So ano yung mga naging obserbasyon natin sa ating measles? Una, dito sa datos natin, makikita natin na nitong nakaraang dekada, no, meron tayong dalawang large-scale wide-scale na mga outbreaks noong 2014 at yung ikalawa ay nagsimula ng 2018 hanggang 2019. Makikita din natin at obserbahan natin yung mga linya na nagre-represent ng ating vaccination coverage for measles na ang mga outbreaks na to ay kadalasan na meron munang tuloy-tuloy na pagsadsad ng ating measles rubella coverage bago tayo nagkakaroon ng mga large-scale outbreaks. Na-observe din natin na sa panahon ng outbreak at tayo ay nag-supplemental immunization activities at mga outbreak response immunization, napapataas naman natin ang ating vaccine coverage. Umaabot tayo ng 80 to 90%. Subalit, hindi natin to nasusustain, no? At pagkatapos ng mga SIA at mga ORI ay bumabagsak uli ang ating mga vaccine coverage. Itong mga tayo ngayon ay nasa ikatlong taon mula ng huli nating outbreak ng 2019 at makikita nyo na may cycle siya ng every 4 to 5 years tayo ay nagkakaroon ng ganitong outbreak. Kaya naman tayo nga ay nagsasabi na posible, no, there's an impending outbreak possibly in the next year or 2 kung hindi natin maipapataas ang ating vaccination coverage. Tayo din ay naggawa, no, ng measles risk assessment para malaman natin at ito ay base sa gaano ba karami ang nade-detect ng ating surveillance system at ang ating vaccine coverage. So ano yung naging naging resulta ng assessment na to? Una, makikita natin na nitong nakaraang taon, meron tayong 1.6 million, no, na unvaccinated children, no. This is 2021. No? This is just for 2021. We have not yet accounted. Kung i-account natin yung mga hindi nabakunahan ng mga taon before 2021, aabot siya sa higit 3 milyon. And that's a large number of children that we have not been which are not vaccinated. Kaya naman nakikita dito sa mapa sa right na lahat ng rehiyon sa Pilipinas ay at high risk for a measles outbreak dahil sa mababang coverage ng measles vaccination, at ikalawa, tayo din ay may mababang detection ng measles, no? So kailangan i-improve hindi lamang ang vaccination but the surveillance for measles. So what's our current situation? As seen in this graph, makikita natin na while ang mga kaso ng measles represented by the yellow bars are actually higher in 2022, it's 167% higher than in 2021, hindi pa tayo umaabot sa tinatawag nating alert, which is the blue line, or the epidemic threshold, which is the red line. No? Base rin sa datos natin, sino ba ang naapektuhan kadalasan ng measles? It's the children aged under 5 years old, which comprise 62% of all of our measles cases. Regionally, makikita natin na meron tayong 48 reported measles nitong 3 to 4 weeks ago, and this is higher by 66%, no? Versus 5 to 6 weeks ago. Meron tayong maliliit, no, na mga pagtaas ng kaso na naobserbahan sa siyam na rehiyon, which are the ones na meron pong marka na red, no? At itong pagtaas ay hindi lamang nitong 3 to 4 weeks ago. For most of the regions, it was also observed more recently. So sabihin, hindi lamang to dating pagtaas, kahit nitong nakaraang 2 linggo, nakikita natin ang either bago o tuloy-tuloy na pagtaas ng mga reported measles in our regions. So we'd like to flag that first, there are some regions which have actually exceeded, no, the epidemic threshold. And this includes Calabarzon, Mimaropa, 5, 7, and NCR. Pero gusto nating iklaro na while regionally they exceeded their epidemic threshold, we have not identified a province, HUC, or ICC na lumagpas sa ating epidemic threshold. Subalit, meron tayong 17 provinces, HUCs, and ICCs na gusto nating na tayo ay nagpo-closely monitor dahil ito yung mga lugar kung saan merong pagtaas o tuloy-tuloy na pagtaas nitong nakaraang buwan. And lastly, ang gusto nating pag-usapan ay ang rabies, no, which is another disease for elimination. Nitong taon, tayo ay nakahanap, no, ng 284 rabies cases. These are 70 cases or 33% higher than what we reported in 2021. Karamihan ay mga lalaki, 14% ay mga matatanda. No? I-note ko lang po, no, na kadalasan ang isang rabies case ay mga deaths na po. Wala tayo halos nakikita na rabies na buhay pa. So anong ibig sabihin? 100% ang case fatality or chance na mamatay ng isang taong may rabies. Gusto rin nating ipakita na actually 86%, no, ng mga kaso natin ng rabies ay nakagat ng isang aso. No? And of these, 52% are actually domesticated dogs, meaning mga alaga natin po sa bahay. At from this 128 na mga domesticated or mga pets natin, 67% are mga unvaccinated dogs. So, yung nasasabi na kadalasan, mga asong gala lamang ang pwedeng maging dahilan para tayo ay magka-rabies ay hindi totoo. No? Posibleng makuha siya even from our own pets, lalo na kung sila po ay mga hindi bakunado or hindi up-to-date ang kanilang mga bakuna. Kaya nga nakikita natin na 72% ng ating mga rabies cases ay yung mga hindi naka-avail ng tinatawag nating post-exposure prophylaxis, meaning pagkatapos ng kanilang animal bite, hindi sila nakapagpatingin, hindi sila nabakunahan, at hindi sila nabigyan ng tinatawag nating mga immunoglobulins laban po sa rabies virus. Nitong nakaraang 3 hanggang 4 na linggo, may nakita tayong 15 rabies cases. Ito ay actually lower, no? 32% lower than what we saw 5 to 6 weeks ago. may iilan tayong pagtaas, no, o additional na kaso, lalo na sa Mimaropa, Regions 5, 11, and NCR. No? Kaya nakakikita kayo ng mga red arrows na pataas. Ngayon, gusto lang nating i-update din na meron tayong mga tinatawag na rabies free zones. No? Ito yung mga probinsya. Ngayon, meron tayong 9 na probinsya na dineklara nating rabies free zone, and of that, 8 ang naiiwan na this rabies free, no? Pero meron tayong isang lugar na kailangang i-assess at mag-reapply dahil while wala tayong nakitang human rabies case doon, meron kasing nakita ang ating Bureau of Animal Industry under the Department of Agriculture na aso, na animals, let me correct myself, animals na positibo sa rabies. Meron din tayong 45 na rabies-free areas. Ito yung mga city, municipality, barangay. At ito ay mga naiiwan naman pong rabies-free. Meron din tayong ilang lugar na naiwan pong, meron tayong mga bagong lugar na naiiwan pong rabies-free nitong nakaraang 5 buwan. At meron tayong 71 provinces. Yung 200 plus na rabies case natin ay nanggaling sa 71 provinces across our country. And these are the areas kung saan wala tayong natalang any rabies case mula 2017 hanggang 2022. Sila yung mga eligible at mga kailangan nating i-assess kung posible na silang ideklara ng mga rabies-free zone. But note lang na hindi lamang kawalan, no, ng mga rabies cases na human ang basihan nito, kailangan wala rin tayong nakikitang mga animals doon na may rabies, no, at na may maintenance, no, ang good vaccination amongst the animals in that area para sila din ay ma-declare na mga rabies-free zones. Pinapaabot na natin na dito sa mga sakit, no, na ating na-i-report at tayo ay nakakita either ng clustering or outbreaks, ang mga naging response natin ay una, tayo ay nagkakaroon ng field and outbreak investigations para malaman, no, at ma-verify kung ito ay mga totoong pagtaas at totoong outbreak at malaman natin, no, sino ba yung mga pinaka-apektadong lugar at populasyon. Kahalaga na isang response na ginawa natin ay improve, no, yung ating access, no, to both primary and higher specialty care, and that includes the opening of dengue fast lanes in our hospitals. Tayo din ay namahagi ng mga polisiya as guidance, no, to our local and regional offices as well as technical assistance kung tayo ay hiningan, no. Nag-augment din tayo ng mga logistics, and that includes for our food and waterborne disease outbreaks and clustering, chlorine tablets to ensure safe water and IV fluids, no. For dengue, that includes larvicides and sprays. And there have been vaccines, no, deployed doon sa mga nagko-conduct ng outbreak response immunizations, doon sa mga nahanapan ng mga kaso ng measles. Tayo din ay nagpadala ng mga field investigation teams, and these are our FETP fellows para tumulong sa mga ginawang investigations ng ating mga local government units. At ang Department of Health kasamang ating mga regional and local counterparts ay tuloy-tuloy na nagmo-monitor ng ating mga sitwasyon. To end, we'd like to put across these key messages. So in general, no, mas marami na tayong nakre-report na mga kaso nitong taon, no, ng mga non-COVID diseases. At yun ay posibleng dahil sa una, naging mas active na ang ating disease surveillance ngayong taon. Pero makikita din natin na tumataas na rin kasi yung risk natin, no, to get these diseases as we become more mobile, no. Pero may pamamaraan pa rin upang ma-prevent natin ang mga sakit na to. We need to ensure safe access to safe water and food, as well as hand washing, no, for our food and waterborne diseases. Ang pagbabakuna at masking ay mahalaga para ma-prevent ang transmission ng measles at rubella. We have our 4S strategy for dengue, and it's also vaccination and responsible pet ownership for our rabies disease. Makikita natin sa prevention na yung mga ginagawa nating intervention nung panahon ng COVID, which is hand washing, masking, bakuna are still the same core strategy to prevent other infectious diseases. And we'd like to be able to continue, no, na yun ang safe habits po natin. Gusto rin nating ipaabot na liban sa Department of Health, ang ating mga local government units are really vital, no, in the prevention and control of these diseases. They can adopt locally relevant policies and strategies aligned to the national guidelines. Pwede rin na sa pamamagitan, no, na pagbabantay ng ating mga alert and epidemic thresholds, ito yung nagtitrigger, no, ng additional na investigation at ito yung basihan para mag-declare sila ng outbreak. Ang ating mga LGUs ay merong authority to declare localized outbreaks, but it has to be supported by sufficient scientific evidence based on our disease surveillance data, epi and environmental investigation, and even laboratory confirmation. No? So with that, maraming salamat and good day, no, to everyone. Back to you, Laura.
Maraming salamat po, Doc Thea. No, just to reiterate what Doc Thea said about alert and epidemic thresholds, a breach in this threshold may trigger investigations, no, and could be a part of considerations for an outbreak declaration. But this should not be the sole basis for such declarations. So now to talk about sectoral interventions and reforms, as well as the social determinants of health, Yusek Bev, the floor is yours po.
Thank you, Laura. Just give me a minute. Thank you. Next slide, please. Maybe this is not the first time that many of you have seen this, but basically what we're trying to say here is that oftentimes we look at what happens in the clinics and hospitals as the main driver for how healthy a population is. So that's your bottom 20%. That's the green one. However, studies repeatedly show that people's health or an entire population's health is largely dependent on socioeconomic factors, physical environment, and their health behavior, which constitutes a total of 80% of this pie. Next slide, please. So what does this mean? How will we address this if we're saying 80% is not going to be achieved by working in hospitals and clinics? We know that people are actually spending most of their time in schools, in communities, and in the workplace. However, how we have previously attacked the problem, which is turuan natin yung mga tao, no? So health literacy alone will not be able to help us also. So this framework is what the DOH is adopting, and also encouraging all our partners and other sectors to adopt it, is that as much as we would want to help the individuals by improving their knowledge, beliefs, attitudes, and skills to be better, to practice healthier behavior, it is important for us to also help shape the interpersonal level, which would include families, friends, and neighbors, the community level, changing norms, traditions, and cultures, as well as at the institutional level. No? Hindi nakasisi or nakaatang sa shoulders ng individuals lang lahat ng kailangan nila gawin. And this framework is called Healthy People and Places Framework, which we have been using and will continue to adopt. So what does this mean in practice? Next slide, please. So we do know that less than half of the population in the country have what we would call sufficient comprehensive health literacy. And when we say health literacy, it means that someone is able to do something because they're able to access, understand, appraise, and apply the health information that has been given to them. So whether that is deciding to get COVID vaccination or deciding that they will wear boots before they go out kasi bahana no, sa Taft Avenue. So these are signs of whether someone has sufficient comprehensive health literacy. So way back in 2018, we had this research done by UP College of Medicine and UP College of Public Health, and it shows that only 40% of Filipinos have sufficient comprehensive health literacy. And if you're even talking about excellent comprehensive health literacy, this is only less than 10%. No? So we have an updated study on this, but we will be publishing the results in a month's time. So please look forward to it. But all we're saying is that health literacy alone will not help us immediately address what we need to. So there has to be complementary steps. Next slide, please. So just applying what Dr. Thea has already presented to us, what does the framework mean in terms of the different diseases that we just talked about? This list is not exhaustive and not comprehensive, but it's meant to show you what this framework means in terms of ano yung pwede natin lahat gawin. No? So for example, if you're talking about waterborne diseases such as cholera or diarrhea, what are the socioeconomic, physical, environment, behavior-related, and healthcare access-related concerns? So that will help us, say, reduce cholera outbreaks or even just incidents of cholera or diarrhea. So for example, we know from literature that it's related to socioeconomic status. And that is because socioeconomic status is closely related to the physical environment also, diba? So if someone is living in an area where there's still open defecation, for example, no sanitary toilets, no safe water supply, kasi hindi pa pipe, no? Yung water that goes into their household, uncertain yung safety niya, diba? So then, of course, they are immediately at risk, no? Compared to someone who's probably living in the city, in your condo, lahat kayo, no? Piped water na malinis, di ba? And then behavior-wise, no, what is the responsibility then of the individual or the family? To be able to drink only boiled or safe water, eating only cooked meat and fish, for example, and regularly washing their hands, no? So if you talk about just behavior, no, if we use the old framework of health literacy lang, behavior lang, sasabihin natin, oh, ito lang yung gawin nyo, itong tatlo, hindi ka magkaka-cholera or diarrhea. But if we look, step back a little bit, how can someone do that if they're actually in a place where they're constantly exposed, no? And this is why the work that, say, public health authorities like DOH and the LGUs will play an important role in terms of addressing the non-individual behavior interventions, no, which are related to socioeconomic and physical environmental factors. Then, of course, if someone already has the symptoms of cholera or diarrhea, that's where the healthcare access part comes in. No, they will have to do early consult and then maybe take oral dehydration salt. So in the same way, no, so we know for influenza, socioeconomic status, age have increased risk factors, as well as interestingly, workplace policies and school policies, whether the workplace would say most of its worker may free vaccination kunwari for flu, diba? So these are things that actually based on the literature have an effect. No? Definitely in terms of physical environment, mas masikip, mas crowded, kung saan ka nakatira, mas malaking chance na mahawaan ka. So behavior-wise, as Director Thea has already emphasized, masking is not just for COVID, it can also help us for protecting ourselves from flu, especially flu season, or pag nag-change yung weather. And of course, vaccination is definitely recommended for elderly population. So ganun ulit, the moment may symptoms, ability to do early consult and supportive therapy. For leptospirosis naman, anong mga meron, Based on literature, we know pwede rin siyang matransmit, from a mother who had lepto to the child, pag hindi siya na-treat immediately. And of course, the non-treatment or non-early access is again a factor of socioeconomic conditions. Physical environment, alam niyo na po yan, areas that are flood-prone or even exposed to open sewage systems. So behavior-wise, we ask people to avoid wading in flood water, using appropriate footwear if they have to, so may baon kang bota kung pwede, and then hiking and camping safely, because the certain animals are more you're going to be exposed to more of them in certain areas. So healthcare access wise, again, early consult and use of post-exposure prophylaxis. Yung mga pinapainom nating doxycycline, for example, sa mga kaka-wade lang in the flood water na may sugat, lalo may open wound sa paa. Then for dengue, we do know physical environment plays a big role again, uncovered water containers, and whether the area does vector control measures. So if you live in a community, perhaps a wealthier community, you will expect your barangay to have done these vector control measures. But if you live in highly dense, super crowded, more depressed areas, it will be difficult, for your local community to even have done these measures. And syempre, kung wala ulit kayong piped water, everyone will have all these ipon, ipon na tubig. So that's uncovered water containers. So for behavior-wise, we ask people, to wear their long sleeves, use repellents, etc., etc. Then for measles, again, school policies will play a role here. We do know that density and exposure to unvaccinated sick individuals who still go to school, for example, mahawa yung other kids, if they're also not vaccinated. So for this, again, masking is useful and we want children to be vaccinated. So what does all of these tell us? Again, the individual skills and knowledge are important, but the societal, community level initiatives that are beyond one individual or one family plays a very big role. Next slide, please. So with that, we have in the DOH, the priority areas for health promotion are these 7 areas. But for the communicable diseases that we have just discussed today, most of it, are centered, the behaviors are centered around these 2 priority areas of environmental health and vaccines and immunization. Next slide, please. So this is largely hygiene, taking care of our environment. And so for these interventions, we need to make sure that we have complementary work, So from healthy public policies to creating supportive environments, so healthy schools, healthy workplaces, developing personal skills of people, strengthening action within the community, hindi to individual work lang, and reorienting our health services. Next slide, please. So maraming po kaming mga polisiya na ginagawa, So much of what you see here are largely for non-communicable diseases kasi our policies for communicable diseases are pretty set in stone, no, for many years already. Next slide, please. We also have tools for people to improve health literacy and healthy living. So specifically, you will get a lot of tips in laymanized manner, not just on healthy behaviors, but on basic medicines, no, or sickness in our healthyfilipinas.ph website, which is something that is a collaboration of the DOH with PHAP and of USAID. Next slide. And then finally, we have more work at the community level. No, this is not just about informing people, but having services on the ground. So for healthy communities, our main partner is DILG. For healthy schools, DepEd, CHED, DSWD, TESDA, LED. No? And then for healthy workplace, this is CSC and DOLE. So expect that we will be sharing with you in the next few weeks more of our work the last 2 years with these agencies, so you can see tangible examples of how healthy communities, healthy schools, and healthy workplace happen. Next, please. So sa healthy communities, we do have playbooks. So all-in-one guide. So dito meron kaming playbook for hand hygiene, for example, on how LGUs can do this better, as well as bakuna champions. So in order to increase vaccination rates, no, not just COVID vaccination rates, but routine immunization rates in their areas. Next, please. And so we've given grants to 33 provinces this year to implement these programs. So for healthy schools, while we do have pilot that's centered on mental health, sexual reproductive health, it also includes immunization. No? Plus, syempre, yung DepEd, meron na pong existing na okay sa DepEd program, no, which promotes a lot of the hand hygiene practices. So dito po, we have 220 last mile schools in 9 province and citywide health systems. Kita nyo dyan sa screen who are participating in this pilot. So hopefully, we will be able to see better outcomes in terms of immunization, mental health, and sexual and reproductive health in these schools. So parang pinapakita po namin sa inyo is the work that we're doing alongside our media partners, which is to inform our people through above-the-line communication is very important. But we need to complement it with on-the-ground activities, which are in communities and which are in schools. Next slide, please. So with that, I'll end this short presentation with this diagram, no, that for the 40, 10, and 30, or cumulative 80%, we want to protect and enable Filipinos to care for themselves and the community. And for the bottom 20%, we want to be able to take care of Filipinos when they need it. And this is the part where primary care, yung palagi pong sinasabi ni OIC Rosette, no, we will need to beef up our primary care because this is the first line, no, na nagkukonsulta yung mga pasyente sa ating healthcare system. So with that, thank you very much, and back to you, Doc Laura.
Maraming salamat po, Yusek Bev, for a very comprehensive discussion on the social determinants of health. Now we'll try our best to accommodate all the submitted questions given the time we have left. Now to start off, this question is from Rafael Bosano from ABS-CBN News. Sabi ng WHO, ang mga sakit gaya ng cholera ay turbocharged by climate change. Pwede niyo po ba ipaliwanag in simple terms how public health is directly impacted by climate change? Marami kasi sa ating mga kababayan ang hindi nakakaintindi sa siyensya ng climate change, but we have to live with its effects every day. Yusek Bev?
I think yung klaro lang po sa atin, no, is una, klaro sa ating presentation na yung environment natin, hindi nakahiwalay yung tao sa environment. No? So that means, first of all, the physical environment, but also the environment where bacteria, viruses interact, diba? Nagkakaroon ng mga mutations, etc. No? Yung mga viruses kasi kailangan nilang or mga bacteria kasi kailangan nilang mabuhay. At dahil nagbabago yung kinakabuhayan nilang sitwasyon, no? 'Di ba, survival of the fittest yung sinasabi. So, yung dating nagbabago yung Earth natin ng years, hundreds of years bago nagbabago yung temperatura, bago nagbabago yung substance, no, ng mga soil, ng mga tubig natin. Ngayon, nakikita ng siyensya na ang bilis, no? So, ibig sabihin, kahit yung mga maliliit na microorganismo, para mabuhay sila, para hindi sila ma-extinct, kailangan din nilang magbago. Pero hindi naman din ganun kabilis, no? Natin napapag-aralan sila kasi ang dami nating gustong pag-aralan. So I think that's the simplest way we can say na bakit, no, dumadating yung mga bagong sakit or mga dating sakit na mas nagiging mas matapang. Kasi kailangan tumapang ng mga microorganismo para mabuhay sila sa mundo. At dahil tumapang sila, tayo yung biktima nila. No? So we just cannot parang separate ourselves from what's happening with the world and the rest of the microorganisms. I hope that's clear. Thank you.
Thank you po, Yusek Bev. The same from Rafael Bosano pa rin po, Yusek. Paano nakikipagtulungan ang DOH sa ibang ahensya para masolusyonan ang problemang dulot ng climate change na isa sa mga dahilan kung bakit mas lumalaganap ang mga sakit? Aside from wild diseases po, what are other pathogens or illnesses we can get from frequently changing weather and environment patterns?
Sige, maybe I'll just answer the first part, no? Ano yung mga other initiatives natin? So today, in fact, no, we are working with the different agencies to update our National Environmental Health Action Plan. Definitely, hindi tayo yung primary agency for climate change, no? So meron tayong DNR, Climate Change Commission, but we are part of their efforts in the same way that they are part of our efforts too. No? So the NEHAP is supposed to be updated this year. So we're putting out a new NEHAP until 2030. No? So that will be our roadmap for how we will do this. Second is, makita nyo dun sa presentation, no? May part na preventive, may part na curative. So dun sa preventive part, na-discuss namin, no? Ito yung mga plano to be in schools, to be in workplaces, to be in communities, and enable people and the communities to do work that supports better environmental health. Pero meron din pong opisina dito sa DOH, ang Health Facility Development Bureau, no, na in charge sa pag-develop po ng standards ng mga ospital. So alam din natin na yung mga hospitals natin, because of the waste that are being produced, no, so yung mga disposable syringe, for example, etc., meron po yung impact sa climate, di ba? So dahil doon, meron na pong efforts for the many years in the past hanggang ngayon, no, na tinutulungan yung mga hospitals natin in order to capacitate them para mas better ba sila mag-dispose, mas maayos ba, will they do incineration or not for certain infectious waste, for example, at iba-iba pa, no? At sinasabi nga nila, ito ay part ng Green Hospitals Movement. So, meron naman tayong efforts doon para din naman, hindi lang tayo nagpe-prevent, hindi rin tayo nakakadagdag pa, no, doon sa issues ng climate change or pollution.
Laura, I think you're on mute.
Thank you po, Yusek Bev and Doc Thea. For the second part of the question po, which is aside from the wild diseases, ano pa daw po ba ang ibang sakit na pwede nating makuha from frequently changing weather and environment patterns? Maybe Doc Thea can add to this po.
Yes, thank you, Laura. No? Kung makikita din natin sa presentation earlier ni sector, even the diseases na hindi nga wild, in one way or another, no, our physical environment can affect. Mostly those that will lead to more crowding would mean more mobile, or where more in contact with other people, no? Doon papasok yung mas nagiging at risk tayo because mas at risk tayo sa measles, sa influenza, sa dengue, no? So, maybe not directly dahil naging flood prone or dahil nasira yung environment, but all of these little changes, pag nagsama-sama siya, and it changes how we move together, how we congregate together, it will impact, no? Lalo na with other infectious diseases. Hope that answers your question.
Thank you po, Doc Thea. Now for the next question po from Caroline Bonkin of CNN. What is the acceptable incidence rate for cholera per 1 million population? A similar question po, who determines that there is an outbreak in a certain area? And are there standard parameters used in classifying a disease as such?
Sige, I'll answer that, Laura.
Yes, po.
There's actually no set threshold, no, para masabi natin na acceptable ang isang sakit or even diseases such as cholera. What WHO is actually targeting is gusto niya talaga, of course, is ma-eliminate ang cholera globally. No? Pero alam natin na meron talagang mga lugar na tinatawag na nating endemic at isa tayo doon, no, ang Pilipinas. So ano yung siniset natin na standard para sa atin? Doon pumapasok yung mga tinatawag nating epidemic and alert threshold. So tinitingnan natin ano yung usual na rate ng pagkakasakit dito sa Pilipinas. Tapos minomonitor natin kung may mga bigla ang pagdami o pagtaas ng rate na to. At doon nga pumapasok yung ating epidemic or alert thresholds. Now let's go on na anong connection nitong mga thresholds na to doon sa tinatawag nating outbreak, no? Ang outbreak, pag dinefine mo naman siya, is very general. Basta may unusual increase in a specific area across a certain time period, that can be an outbreak. Pero, pinaklarify natin na may mga iba't ibang parameters na pwede tayong gamitin for an endemic disease such as the diarrhea, dengue, and cholera. Ito ay kombinasyon ng number 1, sila ba ay lumagpas na sa ating epidemic threshold? Ikalawa, yung trend ba natin ay tuloy-tuloy, no, yung pagdami ng kaso na noo-obserbahan natin. Ikatlo, mahalaga yung laboratory confirmation kasi baka naman puro suspect or probable na kaso lamang ang nare-report sa atin tapos hindi naman pala sila mga confirmed cases na tinatawag. So, yung tatlong bagay na yun ay dapat na iniimbestigahan, inaalam, para base doon tayo makakapag-declare ng tinatawag nating outbreak. So, yung tanong na pinakahuli, sino ba dapat? May karapatan ng ating mga local government units na mag-declare. Hindi lamang DOH ang dapat na nagde-declare ng outbreak. Tulad ng nabanggit ko earlier, as long as their declaration is supported, no, by validated by sufficient scientific evidence. No? It's a combination of epidemiological, environmental, and laboratory confirmation and investigation. They can declare an outbreak. Kailan papasok ang Department of Health? At ano ba yung mga pwedeng DOH lang ang mag-declare? Doon papasok yung mga nationwide na mga outbreak. So hindi pwedeng mag-declare ang LG na, uy, may national outbreak ng dengue. Department of Health lamang ang pwedeng gumawa doon. Department of Health din ang may karapatan na magrekomenda na, uy, meron tayong national level na public health emergency. Doon papasok ang ating department.
Thank you po, Dr. Thea. I think that answers the questions of Ms. Caroline Bonkin and Mr. Red Mendoza po regarding who declares outbreak in areas po. Next question po from Ms. Caroline Bonkin pa rin po from CNN. Bakit po mas mataas yung cases noong 2017? What happened during that year that could have affected the increase in these diseases po?
Okay, I'll answer, no. Like most endemic disease, meron siyang tinatawag naming seasonality, no? May panahon na bigla talaga siyang dadami, tapos kakaunti siya. Nung 2017, we had major diarrhea outbreaks, no? Totaling hundreds of cases in certain areas, no? At yun ang naging dahilan kaya bigla, no, yung pagdami ng mga kaso ng 2017. So anyway, on a more technical aspect, pag tayo ay nako-compute itong mga epidemic and alert thresholds, tinatanggal natin yung mga taong yun kasi ayaw nating mabias, di ba? Parang outlier yun kakaiba yun. So tinatanggal natin yung mga taon na tinatawag namin outbreak years para malaman at makita pa rin natin ano ba talaga yung usual number of cases kung walang mga outbreaks. Back to you, Laura.
Maraming salamat po, Doc Thea. For your next question po, which is related to the previous question po. This is from Red Mendoza, Doc, from the Manila Times. Ano po ang reason sa pagtaas ng kaso sa ilang mga reportable diseases? And was DOH not able to focus daw po ba in these diseases amid the pandemic?
Okay, so tulad ng nabanggit ka earlier, no, dalawa yung posibleng dahilan kaya tayo ay may mas maraming nakikitang mga sakit ngayon. Una, totoo naman na noong panahon ng pandemya, ang ating mga resources ay mostly focused on COVID, no? Kaya yung detection ng iba't mga sakit ay bumaba talaga. So yung pagtaas na nakikita natin ngayong taon ay posibleng epekto siya na mas nakakapaghanap na tayo. Mas nagiging active na yung surveillance natin dito sa mga non-COVID cases na to. Pero alam din natin na posibleng nagkaroon ng pagtaas ng mga kaso ngayon dahil tayo rin naman ay mas magalaw. Nakita natin sa presentation ni Yusek Bev ng isang nagbago ngayon at pwedeng makaapekto ng casing cases ay mas crowded na ngayon. Mas mobile na ang mga tao ngayon. Posible na itong mga nakaraang taon ng ating pagpabakuna ay hindi kasing ganda at bumaba talaga yung mga coverage. No? This combination of factors actually led to increases in cases such as dengue. Nakakita tayo noon. Ngayon, dumadami rin yung pag nakikita natin ng mga diarrheal disease. And lastly, yung pina-flag nga natin, an impending outbreak of measles because our vaccine coverage has not really been at par, or has not really met our set targets.
Thank you po, Dr. Thea. So the next set of questions are all related to rabies po, Doc. To go over them, the first is from Caroline Bongkin. Bakit po deadly or almost 100% fatal ang rabies? Paano po ma-prevent ang death from rabies if makagat ng hayop? And yung 14% na hindi dog bites, anong hayop po ito?
Ayan. Thank you, Caroline, for the question. Characteristic ng virus talaga yung fatality rate niya. No? Wala siya sa kung anong edad mo, anong sex mo. Yun ang characteristic talaga ng virus na ito. No? It's 100% fatal. But it doesn't mean na pag nakagat ka, wala nang pag-asa na ikaw ay mabuhay. Doon papasok na una, dapat nililinis agad yung wound. No? Walang nilalagay na bawang dyan, walang alam mo yun, walang traditional na medicine na pwede tayong inumin, gawin para ma-prevent ang rabies. Linisin, magpatingin agad dahil mahalaga na ikaw ay mabakunahan ng anti-rabies at mabigyan ng tinatawag natin mga immunoglobulins. Yun yung either pumapatay doon sa kung may rabies, nung yung nakagat mong aso, yun ang papatay doon sa rabies na nakuha mo. Yun ay dapat agarang gawin. Hindi natin yan pinatatagal. No? Hindi mo rin pwedeng sabihin, ay siguro naka-isang linggo na buhay pa ako or isang buwan na pwedeng buhay pa ako. There are actually cases na it is months later bago lumabas yung mga symptoms. And once you become symptomatic, that's almost always 100% case fatality. So early consult with a healthcare worker in a health facility and vaccination. So sino-sino yung mga nakagaliban sa mga dogs? Mga pusa po. So yung mga sarili nating mga pets talaga. The other percent, that's around 8% po kasi. I think the other 8%, hindi na nila matandaan. Hindi na nila ma-specify kung anong hayop yung nakakagat po sa kanila. So I guess the message is, Sabi nga natin, hindi kesyo alaga mo yan sa bahay, sasabihin sa atin, ay malinis yan, di yan lumalabas. No. You need to get your pets vaccinated. And to answer already the other question, the Bureau of Animal Industry recommends that they get their first vaccination at 3 months and then yearly thereafter. Mahalaga yan, no? Kasi tinatanong yan pag nabakunahan na ba yung aso mo. Minsan, depende no, sa kategory ng kagat, posibleng hindi ka nabakunahan. But you still need to consult para ma-advise ka ng tama ng isang.
Maraming salamat po, Doc Thea. Now, before we move on po, I will just like to inform everybody, Yusek Beverly Ho has to leave po as she has another engagement po. Now, I think we can accommodate na po to our last 2 questions. Pasensya na po sa ating ibang media partners as we will try to accommodate your questions in our other DOH platforms po. Doc Thea, tuwing kailan po dapat bakunahan ang alagang aso sa rabies? Ano pa po ang ibang pets na kailangan pabakunahan?
Sorry, ano yung second medyo hindi ko nakuha? Ano pa yung ibang pets na kailangan pa?
Ano pa po daw yung ibang pets na kailangan pabakunahan?
Yeah. As mentioned, no, the advisory from the Bureau of Animal Industry is once they reach 3 months of age, yung mga alaga natin ay dapat pabakunahan. Tapos yun ay inuulit no kada taon. So hindi yan one shot lang, no. Dapat up to date yung bakuna ng ating mga alagang aso. Lahat ng pets natin, no, mga mammals like pusa, dapat pinapabakunahan yan. Hindi ko alam kung ano pa pong ibang klaseng pets. If you're unsure if your pet, if it's not a cat or a dog, requires vaccination, just consult no yung ating veterinaryo kung ano yung dapat na bakuna. Just gusto ko lang ding idagdag na, you know, of course rabies is one, but you know, as a pet owner, there are actually other vaccines that we should be giving to our pets, no, para hindi lamang sa magka-rabies sila, hindi sila magka-rabies at manghawas sa ibang tao pero for the health din, no, course of our pets.
Maraming salamat po, Doc Thea. Meron po for our last question po. This is from Red Mendoza po, Doc. Baka po may idea po kayo kung sapat pa rin po ba yung bakuna natin for bakuna at gamot for rabies po, Doc? Dahil reportedly daw po ay nagkakaubusan ng supply dito.
Ito ba ay bakuna para sa mga tao? Kasi may bakuna din para sa animals, no? So, siguro to level of, no, yung bakuna kasi sa animals ay it's the accountability or the responsibility of our local government units na, no? So, meron tayong mga provincial, city and municipal either veterinary office or agriculture office, no, na in charge doon sa pag-i-ensure na merong routine or vaccination schedule, no, para sa ating mga alaga, no. But for the Department of Health, I'll have to get back to you on that, no, doon sa issue nagkakakulangan tayo. Pero just to note na usually wala tayong routine vaccination for rabies, no. Ang mga posibleng meron lang binibigyan tayo ng pre-exposure prophylaxis ay yung mga regularly exposed sa mga animals like our veterinarians, for example, di ba? O yung nag-handle ng livestock, ng mga animals. Yun, they can request for bakuna. Pero kadalasan itong mga bakuna na to ay binibigay as a post-exposure. Sabihin pagkatapos kung ikaw ay nakagat, doon natin yan ibibigay. So Laura, we'll check with our program, no? We'll get back to you on that answer. I don't have that information right now. Thanks, Flores.
Thank you po, Doc Thea. Now, some reminders po on how we can prevent these water and foodborne illnesses po. As mentioned earlier by Yusek Bev and Doc Thea, unang-una sa lahat, iwasan nating magtapon ng basura kung saan-saan, kahit na po hindi tag-ulan. Makakatulong po ito sa pananatili ng malinis na kapaligiran na maaaring bahayan po ng lamok at daga. Ngayon naman po sa oras ng pagbaha, iwasan natin ang pagsulong dito. Para sa ating mga kababayan na binabaha po yung mga lugar nila, lagi po ninyong ihahanda yung inyong mga go bags. At isa rin po sa very effective na pamamaraan para po makaiwas tayo sa mga sakit tulad ng cholera, um, um, other water and foodborne illnesses po, make proper hand washing a habit. Drink only safe and clean water po. Huwag tayong uminom ng marumi at kontaminadong tubig dahil marami pong mikrobyo sa maruming tubig at nakakasama po ito sa ating katawan. If hindi po tayo sigurado sa tubig na ating iinumin, pakuluan po natin ito. Ngayon, upon reaching boiling point po, pwede po natin i-extend ito for 3 or more minutes po. At sunod po ay siguraduhin natin na yung ating mga pagkain ay properly cooked and stored po to avoid spoilage and bacterial growth. Para naman po sa dengue, mabuti pong alalahanin natin yung na-mention po ni Doc Thea at ni Yusek Bev na 4S strategy. That is to search and destroy possible breeding grounds by maintaining our surroundings clean po. Secure self-protection by wearing skin repellent and clothes that cover the skin. Seek early consultation po kapag nakakaranas na tayo ng mga sintomas. At support spraying and fogging, especially po dun sa mga hotspot areas. At kung posible, magpabakuna na rin tayo laban sa trangkaso or flu. Doon naman po sa may mga pets, may mga alagang hayop po sa bahay, be responsible pet owners po and get your pets vaccinated. Ngayon naman po, kapag kayo ay nakagat ng isang hayop na potentially ay may rabies, avoid traditional management. Pumunta po kayo agad sa nearest hospital or animal bite center for proper wound care and management. Ngayon po, before we conclude, may I request po Dr. Thea to give her reminders and messages to our media partners and to the public.
Yeah. Thank you, Laura. No? And again, thank you to our media partners. So, siguro tatlong bagay lang, no? Yung mga sakit na to ay mga sakit na posibleng maging malubha, maging dahilan para tayo ay ma-ospital or even no, maging fatality, lalo na sa mga nakakatanda at sa mga pinakabata, no? Pero kaya naman napakahalaga ng agarang pagpapatingin sa isang health facility, whether it's a barangay station, a health center, or a hospital. Early consultation is key to right and timely na management para ma-prevent natin ng mga komplikasyon. No? At yung pinakahuli, meron tayong maraming pwedeng gawin para i-prevent. Ito yung pinapakita ni Yusek Bev na, at the individual level, there are many things that we can do to prevent diseases. Yung nilista natin at inulit nga ni Laura ay yung ginagawa natin ngayong COVID-19 pandemic ay yun pa rin ang mga central strategy to prevent infectious diseases. We vaccinate, we get ourselves vaccinated, up-to-date vaccination. We can still wear masks, no? Lalo na kung kayo ay mga symptomatic, kayo ay nasa loob pa, no? Or meron kayong kasama na may sakit that will prevent transmission. Hand washing, no, is very important to also prevent transmission. And of course, no, very universal naman na ensuring that we only access, eat and drink safe water, no, and safe and well-cooked na pagkain, no. So with those things, there's much we can do to prevent ourselves and our family from getting ill and to prevent any further hospitalizations or complications. So yun lamang, no, Laura, keep safe everyone.
Sabi nga nila, Doc, iba na po ang maagap. Sama-sama nating pigilan ng wild diseases and let's enjoy the rainy season ng ligtas at malusog. That concludes our Kapihan session for today. Maraming salamat po sa ating dear experts at sa lahat po ng media partners na nakasama natin ngayong umaga. Maraming salamat po at ingat po kayong lahat.
Thank you, Laura, to the comms team. Thank you to our media partners. Bye.
Thank you, Dr. Thea.
You're welcome. Thank you to EB.